Australia will start giving the vaccine by mid-late February, starting with the vulnerable people. Are you prepared to have the vaccine when it comes to your turn? This talk may help you to decide whether to have the jab or not. Is the COVID-19 vaccine safe when it has not undergone adequate testing? The US Food and Drug Administration has granted emergency use authorization for COVID-19 vaccines in many countries, and so far it is supposed to be safe from large clinical trials except for minor side effects and reactions lasting for a few days in a very few. In order the authorization to be granted, the vaccine manufacturers need to follow up for at least 2 months after the trial emergency vaccination, and the vaccine must be proved safe and effective in the respective population vaccinated. Dozens of coronavirus vaccines have entered the clinical trials during 2020, and now a handful have been authorized to the public while the developers continue collecting data on their safety and efficacy. In a few months, it is hoped that all these vaccines would have met with all the necessary criteria and the jabs will start with more confidence. Australia could start vaccinating vulnerable groups of the population next month, Prime Minister Scott Morrison has revealed, saying approvals for the Pfizer vaccine were hoped to be finalized by the end of January. He hopes to vaccinate 80,000 people each week to begin with, and for that to build over 4 to 6 weeks.
We want to ensure that Australians, and I think all of us feel very strongly this way, have full confidence, absolute full confidence, that when it gets the tick, they can get the jab and they can make that decision for themselves and for their families confidently. So we're aware of what is happening in other states and other nations around the world. We have a front row seat, frankly, as they go through that and work through any potential issues that may arise.
Brendan Murphy, the professor and secretary of the Federal Health Department, said nearly half the Australian population would be included in one of the priority groups to receive the vaccine in the first half of this year. The rest of the general adult population could expect to receive the vaccine from the middle of the year onwards.
I think we still don't know what the vaccines will do in terms of complete prevention of transmission of the virus. So the vaccines can prevent disease, we know that very clearly. The extent to which they will effectively prevent, for example, asymptomatic transmission or people bring the virus with them when they travel, we still have to find out. So this is an evolving place, and there may well come a time when we have evidence that vaccines are very good at preventing people contracting the infection. In that circumstance, it may be appropriate to allow quarantine-free travel. But this is an evolving space, and we just have to watch and wait as it develops.
Experts still note that the benefits of the vaccine outweigh the small risk. Anaphylaxis after vaccination is rare, occurring at a rate of about 1.31% per million doses of vaccine administration. Of these, 85% are people who have allergies. About 9 million people in the United States have received at least one shot of either the Pfizer or Moderna coronavirus vaccine, the two authorized in the United States. So far, serious problems reported were 29 cases of anaphylaxis, a severe allergic reaction. None were reported as fatal. Many people have had other side effects like sore arms, fatigue, headache, or fever, which are usually transient. Should people with allergies take the jab? CDC, that is the Centers for Disease Control and Prevention, recommends that you should not get either of the currently available messenger RNA COVID-19 vaccines if you have allergies. Australia still has not organized a center for disease control. If you get a COVID-19 vaccine and you think you might be having a severe allergic reaction after leaving the vaccination site, seek immediate medical care for calling the respect emergency number 000 in Australia. All vaccination centers will be equipped to treat allergies immediately after the jab. The common injections given are epinephrine just under the skin or EpiPen. If you get an allergic reaction after the first dose, the CDC recommends that you should not get the second dose. Some of the mild allergic reactions may occur within 4 hours after getting vaccinated, such as hives, swellings, and wheezing respiratory distress. If you have allergies other than to the messenger RNA vaccine, you need to ask your doctor if you should get COVID-19 vaccine. CDC recommends that people with a history of severe allergic reactions not related to vaccines or injectable medications such as food, pet venom, environmental or latex allergies get vaccinated. People with a history of allergies to oral medications or a family history of severe allergic reaction may also get vaccinated. Is the vaccine safe for people with chronic conditions like heart disease and diabetes? People with chronic diseases or compromised immune systems like those taking methotrexate to lower your immune reactions are at a greater risk of more serious illness if you are infected with the coronavirus. So it is advisable to have the jab in such situations. It is best to get advice from your family doctor too. You are at high risk of severe illnesses from COVID-19 if you have had an organ transplant and are on immune suppressive therapy, have had a bone marrow transplant in the past 2 years, are on immune suppressive therapy for graft versus host disease, have had blood cancer in the past 5 years, including leukemia, lymphoma, or myelodysplastic syndrome, are having chemotherapy or radiotherapy. You are at moderate risk of severe illness from COVID-19 if you have chronic renal failure, heart disease, chronic lung disease, excluding mild or moderate asthma, had cancer in the past 12 months, diabetes, severe obesity with body mass of 40 kilograms per m2 or more, chronic liver disease, some neurological conditions such as stroke or dementia, some chronic inflammatory conditions and treatments, other primary or acquired immune deficiency, poorly controlled hypertension may increase risk. Your level of risk depends on other factors including your age, gender, and whether you smoke. So it is advisable to have the jab if you are within any of the above categories. Sri Lanka will get its quota of vaccines by the Indian state-run company. They will buy vaccines from the Serum Institute of India and Bharat Biotech International Limited. Only India can satisfy world demand for COVID-19 vaccine, says Australian Ambassador to India, Barry Farrell. This is what he says.
But there's only one country that has the manufacturing capacity to produce sufficient quantities to satisfy the demand of citizens in every country, and that's India.
A 56-year-old doctor from Florida died weeks ago after receiving the first dose of the coronavirus vaccine manufactured by Pfizer BioNTech. The cause of his death was ruled to be a rare blood disorder and being still investigated whether there was a link with the vaccine. According to Miss Neckelman, 3 days after her husband got the vaccine, he developed tiny reddish spots or petechiae caused by bleeding under the skin of his hands and feet. Recognizing the spots as a danger sign, he went to the emergency room. A blood test showed the level of his platelets, a blood component essential for clotting, to be at 0, she wrote, and he was admitted to intensive care unit with the diagnosis of acute immune thrombocytopenia. In a statement, Pfizer, the maker of the vaccine, said it was actively investigating the case, but we don't believe at this time that there is any direct connection to the vaccine. Any person with a history of a significant allergic reaction to a vaccine, medicine, or food, such as previous history of anaphylactoid reaction, or those who have been advised to carry an adrenaline auto-injector, should not receive the Pfizer BioNTech vaccine, according to the new MHRA guidance. The guidance also notes that resuscitation facilities should be available for all vaccinations at all times. It is also reported a head nurse at the hospital in Chattanooga, Tennessee, caused a brief scare when she fainted shortly after receiving the Pfizer BioNTech COVID-19 vaccine. 4 trial volunteers who got Pfizer COVID-19 vaccine developed Bell's palsy. Should you wear a mask after vaccination? Yes, the 2 vaccines that will potentially get authorized this month clearly protects people from getting sick with COVID-19. But the clinical trials that delivered these results were not designed to determine whether vaccinated people could still spread the coronavirus without developing symptoms. That remains a possibility. We know that people who are naturally infected by the coronavirus can spread it while they are not experiencing any cough or other symptoms. Researchers will be intensely studying this question as the vaccines roll out. In the meantime, even vaccinated people will need to think of themselves as possible spreaders. The vaccine developed by Pfizer and German biotechnology company BioNTech is 95% effective at preventing COVID-19. A large study found needs to be stored. The vaccine has to be stored at minus 70 degrees Celsius. The vaccine developed by US biotech company Moderna and the National Institute of Allergy and Infectious Diseases NIAID also uses messenger RNA as its base and is estimated to be 94.5% effective at preventing COVID-19, and that vaccine should be stored at minus 4 degrees Fahrenheit. The vaccine developed by Oxford University and pharmaceutical company AstraZeneca is estimated to be about 70% effective at preventing COVID-19. The vaccine was about 62% effective. The Chinese company Sinovac Biotech developed a vaccine from an inactivated version of SARS-CoV-2. The vaccine is called CoronaVac. Efficacy rate is 50.4%. The Indian company Bharat Biotech along with the Indian Council of Medical Research and the National Institute of Virology, developed a vaccine from an inactivated coronavirus called Covaxin, the Times reported. The vaccine is given in 2 doses spaced 4 weeks apart and has been authorized for emergency use in India. Its efficacy has not been publicly reported. This is a vaccine that Sri Lanka will get. Dr. Fauci calls the 95% efficacy rate of Pfizer coronavirus vaccine extraordinary. Does that rate sound impressive to you? Why or why not? Let's listen to Dr. Fauci.
As you well know, Operation Warp Speed has been supporting directly and indirectly 6 candidate vaccines, 4 of which are either in or completed phase 3 clinical trial. I want to briefly tell you about 2 of them because you have to be interested in this. It is extraordinarily impressive. 2 of the vaccines, one by Moderna and one by the company Pfizer, have completed trials, and the efficacious vaccine efficacy point is extraordinary. With regard to Pfizer, it was 95% efficacious, not only against disease that's just clinically recognizable disease, but severe disease. There were 10 cases of severe disease, 1 in the vaccine, 9 in the placebo. For the Moderna trial, it was 94.5% efficacious. 11 severe events, 0 in the vaccine, 11 in the placebo. For those of you not acquainted with the field of vaccinology, that is extraordinary. That is almost to the level of what we see with measles, which is 98% effective.
Hope this video talk was useful. To have the vaccine or not to have it because of the side effects is a difficult decision. It is more a family decision than a single person. Some may wait for the herd immunity, that is the immunity you get from indirect protection from an infectious disease that happens when a population is immunized either through vaccinations or immunity developed through previous infections. Attempts to reach herd immunity through exposing people to a virus are scientifically problematic and unethical. Letting COVID-19 spread through populations of any age or health status will lead to unnecessary infections, suffering, and death. Discuss with your family doctor if you have any doubts of getting the vaccine. Stay safe and goodbye for now.